Good morning. I'm Dr. Jessica Sapoff, and you're listening to DentalMD on KKNW Alternative Talk 1150. I am talking about children's natural dentistry today, and we're going to cover everything from babies to teenagers and everything in between. Now, a lot of people have questions about kids, starting with how old should my child be when I bring them in for their first visit? So why don't we just start there? Basically, children start getting their first teeth after 6 months of age, usually. And if you are brushing their teeth or using a little washcloth to clean their teeth, you're going to be looking at the teeth, be noticing whether there are little white spots or little brown spots or little holes or little anything other than beautiful little white square-looking teeth coming through. And those front teeth are going to come in first, usually the 2 lower front teeth and then 2 uppers and then 2 more lowers and then 2 more uppers. And then they will look like they have just some front teeth, which they do. And by 1 year of age, they are starting to get their first year baby molars. That's eventually going to be replaced by an adult premolar. So those baby molars, by age 1, they've got their first primary molar. And by age 2, they're going to have a second primary molar behind that one. So anytime in that first year to year and a half, I would say is a good time to bring that child in and have a fun visit. That fun visit is a great thing to do because they get a ride in the chair and they get their teeth counted and they get told how pretty their teeth are and they get introduced to the suction and the air water syringe, which are, of course, Mr. Thirsty and Mrs. Windy or Squirty or whatever. And so that's a lot of fun. And we really don't want to have to introduce them to Mr. Buzz on the very first visit. So it is good if they can come in without any need for, a procedure on that first couple of visits so they can find out how fun it is to get a ride in the chair and get a toy and all of that stuff. And we've got great treasure chests for kids to choose things, and they can watch the fish in the fish tank and all that stuff. They really have a lot of fun. They actually watch the fish while we talk to the mom and dad or whoever brings them in. And that kind of keeps them occupied while we have a conversation about their teeth and their development and what their needs might be. So I am a very strong advocate of breastfeeding natural food for children, and I actually believe that they should be allowed to eat in public just like everybody else. So if you're breastfeeding and you need to do what I call a download, and breast milk's great because it does have a little bit of a sedative effect. And we'll just give you a few minutes in the chair to go ahead and do that if you need to for your young child. And then we'll come back when you're all finished to take a look and count the teeth. At my office, Natural Dental Health Associates, we see about probably 25% of the practice is teens and younger. And I advocate attachment parenting. So I want whoever would like to be in that room with us, the parents, the siblings, anybody that wants to come in and hang out while we have our fun visit, that is great. The child can sit on mom or dad or, in the chair, and we'll raise the chair all the way up and have you just lay the child on their back, and we give everybody some sunglasses and a towel. And it's very nice. It's very nice for the children. They usually have a very nice first few visits and on into their, childhood and teenager years, because we really don't ever want to traumatize the kids. If they have decay, then what we like to do is take it really slowly. We don't want to jump in there and do anything scary or traumatic. I never want to come at somebody with a needle, like when they first come into the dental office. That is really unnecessary. And for a lot of kids, we can get that decay cleaned up and get a nice white filling on there without even having to use anesthetic. And I'm going to talk a little bit more about that in a few minutes. So for young children, one of the things to know is that they are going to have those teeth until all those primary teeth the front ones are going to begin to get loose and start coming out sometime around age 6, 7, 8. And for those primary molars, those are going to be in there until they're maybe 10 or 11 or even 12, sometimes longer, maybe even 13, before they get loose and come out and are replaced by premolars. But sometime around age 6, a grown-up tooth sneaks in the back behind those primary molars. That's the 6-year molar. So you want to be on the lookout for that so that you can make sure you get all the way to the back and get that one brushed and make sure they know that they've got a big new permanent tooth way in the back that they need to keep clean. Let's see. Let's talk a little bit about decay in those teeth and sealants versus fillings. Sealant materials, I haven't been able to find one that didn't have added fluoride in it. And at my office, we don't use any dental products that have fluoride, and we don't do any fluoride treatments. And I'm going to talk more about why that is so. But for the time being, let's just talk about the difference between sealant material and resin filling materials for kids. Children's teeth don't really bond all that well. For some reason, it has to do with the porosity of the enamel. And so the sealant materials don't tend to stay on for very long. I like to use a better quality material, a flowable composite or a flowable resin, which is a more permanent material, and it works just like the sealant. And the sealants are materials that go into the grooves of the teeth to help prevent decay in those grooves. Now, in my office, I do not like to do any treatment to the teeth unless it is clinically necessary, or for adults, elective care, cosmetic care, whatever people choose to have. But really, it's important to distinguish what's needed. Now, if their molars don't have deep grooves and there aren't a lot of stains and there's no history of decay, I am not going to advocate placing sealants. I'm not just going to place a sealant on every tooth where I can justify it so that your insurance will pay or whatever. That is an unnecessary treatment, and I don't want to expose anybody to anything or place anything permanently in somebody's mouth that isn't necessary. And really, there are a lot of people with teeth that do not have very deep grooves and really do not need to be sealed. If a tooth needs to be sealed, and I say that the tooth needs to be sealed, you can bet that that tooth is at risk, and that if it isn't sealed, there is really a possibility that there's going to be some decay. There are parents and families who have been very, very careful to eat whole foods and breastfeed, long breastfeeding well into the 2nd year and beyond, and eat very high quality food. And yet, a lot of times, those kids will just have a lot of tooth decay in the front and in the back. And it's very hard to understand why that would happen. But while those teeth are forming, that is happening in utero. If the mother is not getting a full range of trace minerals and perhaps maybe under stress and maybe her body isn't quite as healthy as it could be or maybe a little toxic or any of that kind of thing, that can affect development of that child in every way. And one of the things that can be affected is the mineralization of the teeth and how strong those teeth are going to be. Sometimes I will see children who have a lot of decay in the primary teeth, but when those permanent teeth come in, they are terrific. They're wonderful and beautiful and healthy and have very little decay, if any. And so I just want you to know that if your child has a lot of decay as a baby, it does not mean they're going to have decay necessarily when their permanent teeth come in. And that's really good news. So the name of the game when the young child has some decay is to get that cleaned off down to solid tooth structure and then get that bonded and get some material on those to prevent more decay and to get the shape of those teeth back to what it's supposed to be for chewing and so that the front teeth look as normal and pretty as possible. Now, this can be done without causing a lot of trauma. Sometimes it requires more than one visit. If a dentist wants to be very efficient and they see a lot of decay, they may say, Well, the way we treat decay is to get that child in. Let's get it all done in one visit so it's really efficient for you and convenient. And we're going to have to sedate your child because we want to just get it all done, as quickly as we can and prevent abscesses. And, they may even say some scary things about what can happen if you don't hurry up and get this decay taken care of. Well, even if they hurry and rush and sedate your child and get in there and treat everything, because while that child's under sedation, they're going to do the treatments that they think are likely to be needed as well, so that you don't have to sedate your child again and they don't have to undergo a procedure again. So they may actually do some preventive procedures, and you may end up with more intervention than what might have been done if there had been, taken their time and had more appointments. So the alternative to an efficient, quick, get it all over with kind of mentality would be to have a number of visits where that child is taught how to be a dental patient, and we still, teach that child that it's fun to come to the dentist and get your teeth counted. And, today we're going to use the little tiny spoon and clean some of the, sugar bugs off your teeth. And we're going to do that a number of times, which means several visits. But by the time the third or fourth visit comes around and we've got that decay cleaned off so that you can get the xylitol products right all the way onto those teeth instead of trying to get it to soak through a layer of plaque or decay to get in there, we've got that really cleaned off. And now that child is used to coming in and opening and sitting still and relaxing. And you'd be amazed. These kids at 1 and 1.5 years old and 2, they really learn how to be a dental patient. They're still lying on mom or dad, and they're opening their mouth and wearing their sunglasses and letting me get right in there and go ahead and clean the decay. And then when they're really good at cooperating, then we can just go right ahead and dry the tooth, put some filling material in those cavities, cure it with a light, and then we use Mr. Buzz Buzz to smooth it and make it shiny and make the bite feel good. And we really get quite a bit accomplished on these kids without having to sedate them. And many times, if I'm working very gently, we don't need to use anesthetic, which really sets, if you have to use anesthetic on a young child, that kind of sets the tone for the appointment, and they're not super happy after that is done. So, as you can imagine, that's a little scary and a little uncomfortable. And in my office, most of the time, a little unnecessary for these young kids. What you want to do is keep these teeth in there until they get loose and fall out. Now, for those front teeth, if there was a lot of decay, we're only going to try to keep those in until that child is about 6 or 7. So we really we're not looking at having these fillings last for, 20 and 30 years. We really don't need to look at it like that. We just need to take care of the decay and get the child comfortable and prevent problems and have those teeth stay in. Now we're going to go to a break, and we'll be back. You're listening to DentalMD. I'm Dr. Jessica Sapoff.
All right, class, let's hear what everyone did this weekend. Jill?
Well, I raised my older sister to a big oak tree. It was at least 100 years old. My mom said I must have set a record or something. And then we went down by a stream and perched up on this huge rock and saw all of these little minnows swimming around way below us. And then I rescued my little brother from an evil slug king who was guarding him at the bush fortress. And my sister and I brought him back to our super twig fort for safety. And then we all laid out and told stories until it got dark. And the Big Dipper led us all the way home.
Wow! Awesome! Where were you, Jill?
Yeah. We went to the forest. It's not that far away. Anyone want to come this weekend?
Ask your parents to take you and your friends to the forest this week and find the fun, adventurous you. It's closer than you think. Check out discovertheforest.org. Brought to you by the U.S. Forest Service and the Ad Council.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the DentalMD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
There's nothing else like it on the dial. Alternative Talk, 1150 a.m.
I'm Dr. Jessica Sapoff, and you're listening to Dental MD on KKNW Alternative Talk 1150. And I'm talking today about children's dentistry, and I've covered a little bit about the developmental stages and breastfeeding being very, very healthy. Breast milk actually has lots of great enzymes in it, and it actually helps prevent decay. So if your child has cavities in their front teeth and they're a young baby, about a year old or so, I would definitely not stop breastfeeding. Go ahead, breastfeed at night, breastfeed whenever that child wants to, whatever your routine is, because breast milk isn't really a contributor to decay in young children. There is a phenomenon called baby bottle mouth, which is decay from formula, which is not the same as breast milk. But when people started using formula pretty regularly and children were getting decay, at that time, the conventional wisdom was that formula was just as good as breast milk. And so when the kids were getting decay, it was thought that formula and breast milk were both causing, decay in young kids. And even though, the way I say that, it sounds illogical to put that together that way, but that's the way people were thinking about it. But still, if you have a child with decay and you're nursing that child, there are a lot of dentists who will tell you either to stop or to stop nursing at night. And I am here to tell you that that is not necessary, and that even though that's probably heresy to the mainstream, but that breastfeeding is extremely important for attachment parenting, which I'm an advocate of. I believe in really close families, especially at that very young age where that baby really is like an appendage of the mother. It needs to be with that mother, likes to be with that mother. Really, if they get their way, it would be 24 hours a day, right? All right. Well, let's talk a little bit about the decay process. The decay process in teeth, all teeth, is sometimes if the decay is right on a smooth surface of the tooth, right on the front or the back of a tooth, and you can see it, if there has been a lot of fluoride used, then the surface of the tooth may be very hard and stay intact while the decay progresses underneath where you can't see it. If the decay is like a big crater and it's all open and you can see it, that is quite a bit easier to detect at an early stage. I believe that there are many ways to recalcify the surfaces of the teeth, and fluoride does, when used topically, harden the surface of the teeth and make the surface more acid resistant. The problem is that it's also very toxic. And there are other things you can use to harden the surfaces of the teeth. And then, of course, it makes sense not to eat things or consume things that we know contribute to and cause decay. That's a given. Now, one of the things that has been used as an alternative to fluoride is xylitol. And xylitol is very alkalizing, and you don't really want to be consuming it. You don't want your child eating the xylitol because it will actually buffer the stomach acid. And the stomach acid needs to be quite acidic in order to digest food correctly. So you really want to treat the teeth several times a day. Maybe, when that child falls asleep, just get in there with a little Q-tip and dab those, and lift the lip and dab those little teeth with some xylitol so it really just sits on there for a while. And you can do that several times a day. And that will actually arrest the decay. The decay will stop progressing if this is done on a regular basis. Most of the time, it will stop progressing. And if the decay is in between the teeth, then there is the possibility of food getting crammed in, especially around the molars. And it's very important. It can be difficult to get the xylitol to go in between the teeth. If you swish or dab some in there and then use a little dental floss to kind of drag it through between those back teeth, that would be a good idea. Or put it right on the toothbrush and have the child bite on the brush to get those bristles in around the gum line and between the teeth. So decay forms by the bacteria actually live in the holes, and they've been implicated in causing these holes. But it turns out that decay can actually happen even if sugar is introduced into the body through a stomach tube. And so I have my doubts about, maybe some of that was circumstantial evidence that these bacteria have been convicted unfairly. But it's true that there are definitely bacteria in the mouth that when there's decay, there's more of certain kinds of bacteria. That is true. Whether or not they are actually implicated or whether it's circumstantial evidence remains to be seen. The dental community basically feels like more research on decay isn't really needed. They believe they understand what causes decay and that the bacteria cause decay. And if you kill all the bacteria, then you won't get the decay and that kind of thing. It's a bit simplistic. And that, if you use fluoride, then your teeth will be less likely to get decay, which is also debatable. And I recommend, I really encourage people to go ahead and go online and look up fluoride and xylitol and find out where the controversial areas are on these things. There is a huge controversy about fluoride, and both sides call the other unscientific. Whereas there's actually huge volumes of research that have been done on both sides. The question is, follow the money. Who paid for the research? Who did the research? Of course, that's always true that you need to look to see what the funding was on research before you decide whether that's valid. Now, the decay has several zones. The top zone may be kind of a soft, mushy area, and we can just sort of scoop that out with a spoon, and we'll get all the way down to kind of a hard, leathery surface, which is not infected, but it is demineralized. And when I clean out a cavity, I'm going to very gently just remove all the way down to where it feels very, very hard down below. And it may still have a little bit of a leathery feel to it, but it's not soft. And if I'm getting close to the nerve of the tooth, I'm going to stop there and use a filling material right there on top of that will remineralize that area. And most of the time, the nerve down below, it heals and it does well, and it actually lays down new tooth structure from inside the tooth so that it distances itself from that decalcified zone. And on the surface, it's all sealed. There is a lot of difference of opinion on filling teeth this way. And remember, I said that primary teeth are not going to be in there forever. So this technique works very, very well on teeth that are going to be in there for 5 years or 7 years or something like that. Some dentists would say that that is not removing all of the decay, and they want to get in there and remove all of that demineralized layer, even though there's no bacteria in there. And they want to remove all of that, even if they go all the way through it to the pulp tissue. And that's why they prefer to always give anesthetic, because that's the way they work. They want to remove every trace of that. If it's stained, they want to remove it. And if it's the slightest bit soft or leathery feeling, they want to remove it. And if you get in that deep and you're down to structure right near the nerve is going to feel it, and anesthetic is necessary if you're going to work that way. Now, if they get all the way into the nerve tissue, then they're going to do some more procedures for that nerve. And in a child's tooth, they're actually going to use a material that has formaldehyde in it to cauterize the tooth on the inside before they put that filling in. That's called, they use that, they remove a little part of that pulp, and they call it a pulpotomy, which is removing part of the pulp. A pulpectomy would be if the whole thing is taken out all the way down into the canals of the little tooth, the little roots. And because I work gently and I stop before I reach the nerve and I put medications down, pulp capping it's called, to help that nerve recover and remineralize down below, that's why when I'm doing this procedure, it's not really all that uncomfortable. It can be sometimes, and I always have anesthetic right on hand in case anybody decides that they would like some or that they need more, if we've given them some already. And this is an extremely atraumatic way to restore teeth, and it works very, very well in young children. That's the way I've worked for a long time. That technique used to be taught at the Department of Pediatric Dentistry at the University of Washington. It was called ART, atraumatic restorations. And that, another way to call it was scoop and fill, although I'm doing much more than just scooping out the soft decay and filling them. That's like if you're out in the field and you don't have a dental chair and dental equipment, you just do something quick like that. This is more involved than that, but not quite as invasive as, getting all the way down to the pulp and treating the pulp. If that's not necessary, then, that should not be done. Sometimes the teeth will still, the nerve can still devitalize. It doesn't happen very often. But I've seen teeth that were treated, the pulps were treated by other dentists, and those teeth occasionally abscess as well and end up having to be extracted. So in my clinical experience, and I've been in practice for 22 years, it seems to me that the technique I'm using for restoring these cavities in kids is resulting in these children keeping their teeth and the nerves staying healthy almost all the time. If something was already almost to the nerve and the tooth was already beginning to hurt, I will still do this very conservative technique, but many times a tooth that's already in that much trouble, the nerve can still devitalize and end up with an abscess. And so it just depends on the condition of that tooth at the time that we get to see it and treat it. Now, fluoride, as I said earlier, it will remineralize the surfaces of the teeth, and it will harden the surface and make it a little bit more resistant to the acids from the bacteria. And there are safer alternatives. Fluoride, if you go and look it up, you will find out that it's really very highly toxic. If you're putting it on the teeth and then spitting it out, that's not as much of a problem. If you really believe fluoride is what you want to use, just make sure it's not getting swallowed. Fluoride in the water and fluoride that is accidentally swallowed, it is very toxic to the body. And it's not been shown to help the teeth at all to swallow fluoride. It just the fluoride goes into the long bones and has been associated with hip fractures, as a matter of fact, in the elderly in communities that are fluoridated. And you can look that up. That is documented. So I recommend other alternatives like the xylitol or, using salt, good salt, highly mineralized, dried seawater is a very good thing to swish with for a number of reasons. Now, I think we may be getting close to taking a break here, and I'm Dr. Jessica Sapoff. You are listening to DentalMD on KKNW Alternative Talk 1150. You can reach my office by email at appointments@naturaldentist.com, and if you have questions that you'd like me to address on air, please send them to questions@naturaldentist.com. All right, we're going to go to a break, and we'll be back.
This is a remote village in Mali, West Africa. This is Salif Diarra, a local health worker. These are some of the 123 village children who survive life-threatening illnesses because of his efforts. These are the paths that Salif walks, sometimes miles each day, to visit all the sick children in his village. This is Minata, a mother who was afraid she'd lose her 4-year-old daughter to malaria. And this is Maimuna, one of the many children who got her joy back thanks to Salif's efforts. This is you becoming part of the story. You are one step away from helping local health workers like Salif make the good go even further. Visit goodgoes.org to see the many ways you can help. Brought to you by Save the Children and the Ad Council.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the DentalMD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Don't forget, this is Alternative Talk, 1150 a.m.
We're back. This is DentalMD. You're listening to KKNW Alternative Talk 1150, and I'm Dr. Jessica Sapoff. I'm a dentist. I practice in Issaquah at Natural Dental Health Associates. And as I said before we went to break, you can email questions that you would like me to answer on the air in future shows. That would be questions@naturaldentist.com. And if you have a question for my front office, please email at appointments@naturaldentist.com or give us a call, 425-427-8899, and we will get you taken care of. And today I'm talking about children's natural dentistry. Most general dentists don't see children. They refer to pediatric dentists, dentists that only treat children. And that's true for the holistic dental community as well. It may be difficult to find a natural dentist that also sees kids. But we do. I love to see kids. And my practice is more than 25% babies and young kids and teens. So I do a lot of interceptive orthodontic treatment at those early stages to try to prevent the need for full braces later. There are a lot of things that we can do to very gently reshape the arches and make a little more room if needed, correct the vertical height of the bite in case when you see your child bite down and those lower front teeth completely disappear under the upper front teeth. That's called an overclosed bite, and it's really a deficient vertical dimension. It's called, and it's important to correct that because that can lead later in life when the when the permanent teeth come in, that position of the jaw where it's so closed up against the upper teeth, that will sometimes result in problems in the alignment of the joints of your jaw. And that can lead to TMJ problems. TMJ stands for temporomandibular joint. And inside that joint is a little disc that's supposed to slide easily as you open and close. Now, a lot of people have restrictions in their range of motion, and sometimes it's because of years of having an occlusion or a bite that is not completely comfortable for the muscles and for the joints. They may be a little bit out of alignment for a long time and eventually result in degenerative problems or arthritis in the joint and mobility problems, and hopefully not pain, but sometimes. Now, if we jump in at an early stage and correct that vertical dimension and get those permanent teeth in the back that come in around age 6 to come all the way in and support what's called a class 1 occlusion at the proper vertical, that is really the name of the game. And once that is accomplished, as long as the arches are the right size and there's enough room, there's a good chance that child will never need to have orthodontic treatment. And that's what we want to do, is prevent that. Now, as far as orthodontic treatment is concerned, there are a lot of metals that are used in orthodontic treatment. But as you may know, at my office, we don't use anything that contains nickel. And a lot of the orthodontic wires, pretty much all of them, contain nickel. When I make appliances, I will only use titanium, which is a little bit less allergenic and definitely less toxic than nickel. So there are a lot of ways that I've created to make appliances for kids. I don't like to glue things to the teeth if we don't have to. So we actually use a lot of removable appliances that are like retainers, except that they're active and they're maybe increasing the size of the shape, or improving the shape of the arch, and definitely correcting that vertical while those back teeth come in. There are so many things we can do. Any situation that child's mouth has, I can create an appliance to guide the growth for that child so that they grow into a corrected position and hopefully won't need any further orthodontic treatment in the future. And this is called interceptive ortho, or interceptive orthodontic treatment. This is done at the stage when they still have some primary teeth and some permanent teeth. It's a European, I think it originated in Europe, and it was called functional orthodontics for a long time. And I guess it still could be called that. So once we have a child's occlusion taken care of, and we've taken care of those early cavities and gotten those teeth to stay in place until the permanent teeth start erupting and these teeth get loose and fall out, that's the ideal. But once in a while, there will be a tooth that does get an abscess, or a tooth that's been treated, the pulp has been treated, and it doesn't last. It gets reinfected sometimes, and that tooth will have to be removed. What I like to do is refer the children to have these teeth extracted, because I believe that an extraction of a tooth, it is rather traumatic. And I sometimes will do that under local anesthetic, but local anesthetic children don't like it very much. And, even with using nitrous oxide and other things, it's not a very pleasant dental experience. So I actually think it's very appropriate in that case to have a little bit of sedation. And so I go ahead and I refer the kids to an oral surgeon or a pediatric dentist to have any tooth that needs to be extracted taken out, so that when they wake up, they don't really remember the process. And it's not a deep sedation. It's not like general anesthesia like you would have for heart surgery where you're really unconscious. These kids are just rendered a little sleepier than normal, and they don't remember the procedure when it's over because of the kinds of amnesic drugs that are used. And so in their mind, going to the dentist is still a fun and happy experience, which is very important, because you really don't want them to avoid going to the dentist or be afraid to go to the dentist. So once that tooth or teeth are removed, now you have a space, and spaces will be unstable. The teeth that are coming in behind those spaces will tend to lean and drift forward into those spaces, and that creates a problem with the bite in the back. It actually is a collapsed bite, and it reduces the vertical height again. And what happens is then there will not be enough room when that permanent tooth does try to come in later, when it's time for it to come in. So it's very important to get something in there to keep that space. That's called a space maintainer. You might have heard of a space maintainer. You might have seen them in other children that you know. Space maintainers in almost every dental office, universally, are made of nickel. They are not 100% nickel, but they are basically a cheap metal. It's only intended to be in there for, a couple of years until that tooth comes in. But often it involves a band around the back tooth that's cemented in, and a wire that goes across the space to the tooth at the other end of the space and just holds that tooth from drifting. There are other ways to do this besides using that metal. I don't know if you've ever been asked when you went into a dental office whether you had any allergies to metals. Nickel is a very common allergen, and it also comes with a warning label. Anytime there's a dental material that contains some nickel, it actually comes with a warning on it that says, this material contains nickel, which is known in the state of California to cause cancer. Now, anything that comes with a warning like that, I think it is my responsibility to let somebody know that a material I'm about to use in their mouth has this warning. And if there is any other way to do it, to do a procedure or any other material I can use, I will prefer another material to one that comes with a warning like that, or a skull and crossbones on the label, etc. And I think that the consumer, the dental patient, and the parents have a right to know what is in the materials and whether there are hazards. That is just your right to have that information, and you shouldn't necessarily have to know what all those questions are to ask. You should be able to trust that if there was something like that, that somebody would tell you. You shouldn't be out there all on your own trying to know what all the right questions are to ask, or to practically become your own dentist just so that you don't get something done that you didn't want, or not know about all your choices. So there are other ways to preserve that space, and it's very important to get something in there to preserve that space. We have a lot of other things that we've come up with, creative ways to create space maintainers. So I think we're going to go to a break here, and I'm Dr. Jessica Sapoff, and you're listening to DentalMD on KKNW Alternative Talk 1150. We can be reached at appointments@naturaldentist.com, or if you've got questions you'd like me to cover, that's questions@naturaldentist.com. Thank you. We'll see you after the break.
This is the sound of a flat-screen television hurled off a building. Now the new bike your kid wants. These are the things you could have, all cast into oblivion. Because when you throw away money on wasted electricity, you throw away everything you could have bought with it. Use Energy Star light bulbs and appliances, and you could save hundreds of dollars a year. Saving energy saves you money. Learn more at EnergySavers.gov. Brought to you by the U.S. Department of Energy and the Ad Council.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the DentalMD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Look at all the cars. Lots of colored cars. Ah, there's a blue one. Isn't it pretty? Whew, look how fast that red one's going. It's red like that stop sign. Like my jacket.
This is a 38-year-old man.
My jacket's not a car, is it? Is my jacket a car? My jacket is red, but it doesn't go fast.
He may sound a little strange to you and me.
Vroom, vroom, vroom.
But to his 2-year-old son who's interested in cars and colors, he makes perfect sense.
That's the sound cars make.
When you talk with your child, you build vocabulary, and learning starts long before school does. So follow their lead. Take simple everyday moments like eating dinner or just watching cars go by and turn them into learning moments.
Ooh, look, red car.
Yes, and it's moving awfully fast.
Blue car.
Yes, the man in the red car's about to meet the man in the blue car. Get himself a pretty pink ticket.
Turn everyday moments into learning moments. For more tips, go to bornlearning.org. Brought to you by United Way and the Ad Council.
Bringing you fresh perspectives every day. Alternative Talk, 1150 a.m.
Hi, I'm Dr. Jessica Sapoff, and you're listening to DentalMD on KKNW Alternative Talk 1150. My practice is Natural Dental Health Associates in Issaquah, and we can be reached at appointments at naturaldentist.com. And if you have questions that you'd like me to answer on the air in future shows about any dental topic, feel free to just, any question that has come up for you as a result of listening, or just things that have come up when you've been sitting in a dental chair and you're getting told stuff and you're not sure and you have questions, go ahead and email those questions to me, questions@naturaldentist.com. And today I'm talking about children's dentistry, and I've covered, babies and development and breastfeeding, attachment parenting, a little bit about the decay process and alternatives to fluoride, behavior management, multiple appointments where we teach the children how to be a good dental patient rather than using force or sedation right off the bat. And I talked a little bit about materials because when we do interceptive orthodontics to correct the bite and the spacing at that young age, we try to use no nickel. We always use materials that do not contain nickel. I also wanted to talk a little bit now about crowns, because it seems to be a standard of care among mainstream dentists and mainstream pediatric dentists. And by the way, I don't know of any holistic specialists. They are very mainstream as a rule. Some of them are a little more open-minded. But I have yet to come across one who won't use stainless steel crowns on primary molars. If there is a big defect in a molar, there was a big cavity and the molar needs a filling or a restoration, many, many times the dentists that are treating these little primary molars will put something called a stainless steel crown on those molars. Stainless steel contains nickel. So that is a material that I will not use in my office. There really aren't any mainstream acceptable alternatives. On the other hand, we have lots of other things we can make crowns out of and cement them onto those primary teeth. And in my experience, they last very well. Remember, those teeth only have to stay in until that child's about 10 or 11 or 12, and then those are going to get loose and fall out. And so rather than put any kind of crowns on those teeth, I prefer to just do large bonded restorations. It's my understanding that once the nerve on the inside of the tooth has been treated by either because it was thought to be necessary or because the removal of the decay was aggressive and the pulp was reached during the removal of the decay, then those teeth, if the pulp has been treated, they will tend to get a little bit brittle, and it is standard to put a crown on any tooth where the pulp tissue has been treated. In my experience doing large bonded restorations, I have not seen these fail prior to those teeth getting loose and falling out on their own. But the theory is that if there's been pulp treatment, that a crown is what should be placed on there. And I don't know of any other offices that will use anything other than a stainless steel crown. I'd rather go ahead with a filling or my alternative crown materials and just, watch that and maybe rebond it or, do something if it is failing. But I haven't seen any of those fail. I see the teeth get loose and fall out like normal, which is great. So that is a little bit about the crown materials. One of the materials that I like to use is called glass ionomer as a filling material in primary teeth. It doesn't have to be bonded using the standard bonding techniques. In other words, I don't have to put etchant on the tooth and rinse that off and then put a smelly bonding agent onto the tooth and keep it all super dry while we're doing all of that. It's a longer procedure, and that's fine if you need to use a standard resin material in a tooth. But the glass ionomers, they bond to the tooth through a process called chelation. So they actually attach right to the tooth surface directly without all of those intermediate steps. And they seem to attach very, very well to the primary teeth, which are very porous and don't actually bond well using classic bonding techniques. And so that is a a great material for primary teeth. Now, you might be very well informed and you might be having the question in your mind, but wait, don't glass ionomers have fluoride in them? In fact, the dental materials serum testing and other biocompatibility testing has shown that there are some glass ionomers that are better than others in terms of biocompatibility. The glass that is in the glass ionomer material, glass naturally contains fluoride. It is in the crust of the planet. It is in the crust of the earth. It is ubiquitous. It is a naturally occurring fluoride. It does not seem to pose a problem of toxicity when these materials are tested. So technically, this is another one of those areas where a little information can be a dangerous thing. Yes, there technically is fluoride because glass has fluoride. However, it is not a problem in these materials from what I can tell with all of our biocompatibility testing. What you don't want is a glass ionomer material that the dental industry has put added fluoride in, which they tend to do that. And I will not use materials where they've added extra fluoride into the material, which is designed to emanate out of that material into the tooth and into the child's mouth. So that's a little bit about the glass ionomer materials. And they don't tend to be as shiny and pretty as the resins, but when you're talking about a filling in a back molar in a child that's going to get loose and fall out when that child is 10 or 11, I really don't think that's a huge issue. The kids generally aren't super, involved with cosmetic, how their back molars look. And so I just don't think that's a big issue. And it's kind of nice to be able to see where these fillings are so you can monitor them. Now, we're going to be heading into a break. I'm Dr. Jessica Sapoff, and you're listening to DentalMD. Actually, not a break. We are at the end of the hour. Boy, that hour sure goes fast. All right.
It happens. Well, it kind of creeps up on you, doesn't it?
Yeah.
Just like those little teeth. They just kind of sprout.
They just show up.
I know.
All right. Well, thank you so much for listening to this hour of DentalMD. I'm Dr. Jessica Sapoff. My practice is in Issaquah, and you can reach us at appointments@naturaldentist.com. And you've been listening to DentalMD on KKNW Alternative Talk, and I'll be back next Wednesday at 9 a.m., 9 to 10. Thank you.